My name is Rebecca Steiner. I'm a physical therapist. I have a clinic called New Dimensions Physical Therapy. I've been practicing for about 23 years, and I've been specializing in working with runners for about 17 years. And Ben Shook is a physical therapist that works with me, and he's here too to help field questions, because we're happy to speak with you guys individually at the end if you have specific questions. And I do want to address any questions that you do have. I know this time throughout the training season, we end up seeing a lot of foot and ankle and a lot of knee injuries, and so we can address that directly toward the end. In the beginning, I just want to give you guys some ideas of things you can do to improve your running efficiency to help you have the best marathon you can have possible. And right now, you guys are just a few weeks away. And so first, I just really want to acknowledge how far you've come. You've got a lot of miles behind you and on your body. And so really, congratulations for just being this far in your training. How many of you guys do have injuries? Okay. Then I want to make sure that we get around to the things that are specifically concerning you. And how many of you guys is it your first marathon? So a few. All right, very, very, very good. So when we're this close to the marathon, it's hard to like change shoes, throw in a pair of orthotics, do some crazy stuff because you don't want to add a whole new stress to your body. But there are some things you can do right now that can improve your running efficiency that don't have to be compromising, that can only be beneficial. So I want you to think for a second. How many of you guys watched the Olympics? I bet most of us did to some degree, right? It's awesome to watch those Olympic athletes move and use their bodies. And what I think is really cool is if you get to watch them in slow motion, have you noticed how you see their cheeks flap in the wind and how the muscles on their arm just go wherever? They only use the muscles they need to be able to execute the movement pattern they need to do. And there's an obvious reason why that's good, because all the fuel that needs to go to the muscles that you're using goes there. You're not wasting it and holding tension where it's not necessary. But also the body is so crazy wise. When you are not using certain muscles when you're exercising, your blood vessels actually constrict and shunt the blood to your heart so that your heart can pump that blood back out to the muscles you really need. So how is that information helpful to you? Well, when you're running, if you can think about how can I relax more the whole time you're running, pay attention to everything. Pay attention to your jaw, pay attention to your cheeks, pay attention to your tongue, pay attention to your thumbs and how they bounce on your hands, because any extra effort will borrow from the muscles you really need. And the thing I can tell you from experience in working with runners and retraining technique is when matter of fact, two weeks ago, I was working with a woman, and she was running, she looked good. Her overall technique looked good. She was holding a bit of tension in her hands, and as soon as I got her to really relax and get the feeling of letting her thumbs kind of bounce on her hands, her whole technique shifted through her whole body. She became more supple, more resilient. So don't underestimate with a little bit of awareness of one part of your body, how it can affect everything else. So that's one thing that's easy to take into your running right away. Another thing you can start thinking about is your breathing. Breathing's a big deal. And so right now, don't change anything, but I'm going to have you guys, we're going to count how many numbers we get through on an inhale. So when I say go, just take a big inhale for me and I'll count for you. Ready, set, go. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000. So just pay attention to where you stopped. Okay, now I'm going to do an obvious exercise, so bear with me. So squeeze all the air out of your lungs. So exhale for me really big time. Like get all the air out. When you feel like all the air is out, keep squeezing air out. Okay? And now we're going to inhale again. Ready? 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000. So I would expect that most of you feel like you could get more air in after you exhaled, right? So when we're running and we're feeling winded, the first thing we think is, I can get more air in, right? Well, when we do that, like the first time we breathed, we're actually breathing air in on top of stale air in our lungs. And so we don't have as much vital capacity to take more air in. So when you're out running in a few weeks or the next training runs, think about how can I squeeze more air out of my lungs so that I can have more capacity to bring in oxygen. That's pretty easy. Next thing I want you to be aware of is put your hands on your ribs here, because this is the widest part of your rib cage and this is where your lungs become the widest, right? So now I want you to inhale. I want you to see if when you inhale you can get air into this part of your lungs. So if you want to exhale a little first, go for it. But go ahead and inhale in and feel if you can feel your ribs expand in the back and to the sides. Do it a few times and see if you can feel that. For some of you, you're like, yeah, that's no big deal. Others of you, it's like, my ribs do not move there. So feel it. Because why? Because you've got more capacity down here to contain air, and you have more alveoli sacs in the lower recesses of your lungs. And those are the sacs that take the oxygen from the air and put it into your blood. So you've got a greater concentration of alveoli in your lower lungs. So if you can get air in there, you're going to get more oxygen to your muscles. So now feel this. Put your hands on your ribs and bring your body a little bit into this position. I can't tell you how many runners I look at that are running like this. They go hip, upright, going. So get your body in this position, a little dramatic, and go ahead and take a deep breath in. Feel how much air you can get in. Not a lot. And some of you may have a bit of this tendency. It may not be dramatic, but a bit of it. Now contrast that to bringing your front ribs down. So go again, and now inhale. Can you feel how you can start accessing more of your lungs and get more air in your back? So when you're running, if you're feeling winded, start paying attention to where are my ribs. I can tell you whenever I feel winded, my ribs are up. If I get them down, focus on my exhale, all of a sudden that winded, satiated, needing to get satiated feeling is gone. So where you position your diaphragm is a big deal. It's just a subtle change, makes a big difference. Focus on your exhale instead of just grabbing more air in. So those are some things you can do to really help improve your running efficiency. So that's what I want to talk about first, is running efficiency. Okay, so number one, we talked about being relaxed. Secondly, we talked about breath. The next thing I want to mention is alignment. So I'm going to use this little wooden model guy over here to illustrate a point. Okay. When your body is aligned really, really well, first of all, when this guy pushes into the ground with his foot, every ounce of force he pushes into the ground with gets translated on a one-to-one relationship back to his body to make him move. You can appreciate that, right? Okay. If I take his knee and I bend it like that at an angle, and then load his foot. Can you appreciate the vector of that force is going to go ricochet off this way, and only a fraction of the force he just delivered into the ground is going to move him forward. So alignment's a really, really big deal. Again, back into the Olympics, I'm going to show you this, but when we video runners all the time and look at their biomechanics and their technique, a common pattern I see a lot is this. You can see where my leg is crooked here versus straight here. No matter where we place our foot, our knee should track right over our foot. That gives me a lot of power to be able to propel myself forward. It also protects my joints. Can you appreciate that when my knee is like that, that is stressful on my knee joint. Well, that torques my foot and ankle. It also compresses my hip, rotates my pelvis, and it'll affect my low back. Can you appreciate that? So that's a big deal. I mean, I don't know why it seems so like a foreign concept, but our bodies are really similar like car. If we drive our car around out of alignment, our car parts wear down faster. We know this. It's really the same thing with our body. So having things lined up reduces stress on our joints. The second piece is if my leg is like this, these muscles are lengthened, these muscles are shortened. Well, so what? Well, so what would be if I asked you to carry in a bunch of groceries, you'd care really big time where your arm was positioned. You'd put your arm like this and say, load me up. You wouldn't say, load me up here with the long biceps. You wouldn't say, load me up here with the short biceps, because your biceps is at a mechanical disadvantage to function here and here, but not here. It's an optimal length. So when your joints are trued up here, your muscles are an optimal length to work, and you'll get more of what you need from using your muscles. And this is what I thought was so fun, looking at a lot of magazines after the Olympics, and they had a lot of the Olympians in there. And I thought, oh, I'll just maybe find a few pictures. In this one magazine, every picture I found showed someone with phenomenal alignment in terms of how their knee was oriented to their foot. And I could pass these around and y'all can check them out later. But you can check her out. I mean, she's really rotating her hip out. Her knee is still over her foot here and here. Even just in this stance, she's turned out her knees over her foot. This skier, knees over feet.
skater, even though she's got one leg kind of coming backwards, you can begin to make it rotate. She's got this knee still spun out over her skate. This runner, check out how she's lined up to take the load in her body. And it's just every one of them. Even when she's up in the air, where her knee is over her foot. You start watching people around that leg, you don't see that. But if you're an Olympian, you cannot afford to be out of alignment. You lose power, you stretch your joints big time. So, I mean, you can just go from one to another, and they all, even she, when she's crossing over like this playing basketball, her knee is right over her foot. So alignment's a really, really big deal. Right here, too, I love this picture. You see that power in her body? She's a sprinter, real long distance runner, okay, fine. But because she's lined up, she's able to drive. She's not losing 1 ounce. Everything she presses into the ground is propelling her forward big time. It's because she's so well stacked. All right. So alignment.
So what can you guys do about it? Because we're not going to go put orthotics in the next 3 weeks. But what you can do is change how you use your body during the day, because that makes a big impact on how you run. I had a patient come in, it's a good example, years ago. She had knee pain. She was running about 7 miles at the time. She's like, I can't even run anymore. I can't even run 3 miles. My knee's killing me. I said, all right, let me take a look at you. And she worked at Dell. She was sitting down for long hours. And she sat, really kind of a slouched position. And then her hips were really weak. So I gave her some exercises, and I showed her how to sit properly. And I was supposed to see her like 2 weeks later. She got sick. 2 weeks after that, she went out of town. So I didn't see her for 6 weeks. She came back in. I said, so how are you doing? She goes, man, I'm great. I'm back to running. I'm like, really? I said, what helped? She goes, well, I kind of did those exercises a little bit, but what I really did is I changed how I sat. And I never would have thought that would have made a difference, but it made a huge difference. And it does, because what we spend all day long doing with our bodies is what our bodies get good at doing. And if we sit with this leg turned in all the time, when we stand up, it'll want to turn in. And so don't change anything, because I can show you some things to think about when you're sitting and standing that I will make you a better runner. It will tone your body, train your body, so when you get up and use it, it's ready to go. So when you're sitting here, you guys are relaxed. You should be. You're just listening. You're not having to work. You're not having to be at a computer, so your body should be relaxed and soft. Just kind of notice how you are, and notice how you're sitting right now, and just sort of feel your belly and feel how much tone is in your abdominals. There's probably not a whole lot, because a lot of you are in a reclined position, which is fine, because you're not set up to work. But I want to show you, go ahead and for a minute, just sit up really straight and tall for me. Just sort of hold that position. And feel how much effort it takes to hold yourself there. And I'm seeing some people that their diaphragm's starting to go here again. So take a deep breath in this position too. See what it feels like to take a deep breath here. It tells you where your diaphragm is. So it's hard. You know this is like good posture. But sitting like this is really hard, and there's no way you can sustain it for like 8 hours. So let me show you the trick. Go ahead and stand up. And when you sit down, I want you to sit down and pretend like you have a tuxedo on with really long coattails, or you're a cat with a really long tail, and you've got to get your tail out of the way so that you sit on the front of your sit bones. So this time as you sit down, really get your tail back out of the way and sit down. And then come back up. Do you feel, I didn't mean to stand up. So sit back down, it's good practice. Get your tail really out of the way when you sit down, and then be here. Now feel where your body is. You guys look really different. It's not so hard to sit like this if your pelvis is set. Do you feel that? Feel how much tone you have. You should have tone in your abdomen right now a little bit. Not like your abdomen's cranked, but there's resting tone in it. I have people come in and say, Rebecca, man, I'm doing like 300 sit-ups. I've had people say that, 300 sit-ups, and my belly's all pooched, man. What's going on? Well, doing sit-ups makes you really good at getting out of bed, but it doesn't necessarily translate to running. But sitting like this does translate to running. Using your abdominals to support you all day does translate to running. How you stand will translate to running. I had a patient come in, and she had plantar fasciitis in her left foot. And she said, okay, Rebecca, I've been everywhere. I have got Graston on my foot, I have taped it, I have rolled it out, I have laid off, I have taken anti-inflammatories, my foot is killing me. And I said, okay, well, let me watch you run. So watched her run, and she was standing like this. This is no mistake, I'm talking like this. This is how she's standing, talking to me. Let me watch you run. So watched her run on the treadmill, and every time she took a step with this leg, her pelvis would drop, She had less room to swing her leg through, so she had a kind of a hard impact on this foot. I'm exaggerating. But when you're running long distances, a little more stress here, it adds up. Okay, so she was impacting this side. Then she'd come on her left leg. She had plenty of room to swing through here, and then she'd drop and come here. It's like, man, I bet that right hip is weak. So it was. I tested her out, gave her exercise. I said, by the way, try to stand even. Try not to stand like this. Okay. She comes back in 2 or 3 weeks later. She says, I've been doing those exercises, and they do not help. My foot still hurts. I'm like, well, try not standing like this. And she stopped standing like this. That was the beginning to end of all of her foot pain. Seriously. It's a big deal. I've even had a woman, she was a dentist, and she came and she goes, yeah, I need to see my hip. It's killing me when I work. And I need to make an appointment. I said, okay. I said, by the way, before you come in, stop standing like that. She called me and canceled the appointment. She said, my hip feels great now. So yeah, it reduces stress off of your body to stand more neutrally, but it also trains your body to be like this, or you train your body to be like this, or you train your body to be like this, and it will show up when you run. So what can you do in the next 3 weeks? Be aware of how you use your body during the day. Be a little bit more neutral. Your body will be in a better position when you go out and run a marathon in a few weeks. Okay. So muscle recruitment patterns. We talked about alignment. So running efficiency. Number 4, muscle recruitment patterns. So first of all, I want to tell you something that's been really cool for me to learn over the past 6 years that I didn't learn at physical therapy school, is the first question is, can a muscle even fire? And we don't talk about that in physical therapy. That's something I've had to learn elsewhere. And you may think, what in the world are you talking about? Does a muscle fire? Sometimes our muscles don't work well. It's like our brain can't find the muscle. And I've actually had people come in for years and kind of tell me this. They'll say, you know, I've been weightlifting and my right shoulder just never feels as strong as the left one, and I'm training the same on both. Or I run and I feel like I'm kind of dragging this right leg along, like it just doesn't have any snap to it. Or if I do a heel raise, I feel really powerful on this side, but I'm not so powerful on that side. Well, these 2 legs have lived the same life. And why would one be so much weaker than that one? It's not like you're just exercising one side. And that can be because the muscle isn't firing. And we determine that by doing a kind of muscle testing that's called gamma-1 muscle testing, where you initiate the contraction and we try to resist it. And if you can't hold it, that muscle's not synced up. And if that's going on with you, that is something you can also have addressed in the next 3 weeks that can have a profound impact on your performance. I see this a lot, for example, like in hamstring strain. Somebody has repeated hamstring strains, roll it out, massage it, go and push themselves, hamstring starts hurting again. You can test the hamstring and test it as a group, and it'll seem really strong, but you divide up all the divisions, and actually there's 6 different divisions you can test in the hamstring muscle, 6 different divisions. And possibly maybe 3 are working and 3 aren't. So if 3 aren't, you're functioning at 50% capacity. So it's a weakened area neurologically, and so it gets repeatedly strained. And so that's something where a couple visits can get a muscle firing again, and then you can go out and run and have, that's something that can actually change in a couple weeks. So that's one thing to keep in mind. Does the muscle fire? So muscle balances, number 1. Number 2, how muscle recruitment patterns are determined is by how you move. For example, I've had people come in that will have shin splints, for example, and this is a real common one. You have shin splints that are out here and shin splints that are on the inside of your leg. They're 2 different kinds. The classic ones are the ones that are on the inside. I'm going to talk about this one first. A real common thing I see, especially when they have it on both sides, they're like, yeah, I can't run. Every time I run, this muscle just seizes up on me. One common reason is because people aren't picking up their knees high enough. So that's a technique style kind of thing. So when they're running, they have to pick up their foot harder with their anterior tib. And they have to pick it up to clear it during swing phase. That's a long time to hold your foot up running long distance. As opposed to picking the knee up just slightly higher, letting that ankle relax as you bring it through. Then half the time that muscle gets to relax and recover versus constantly being in contraction. So there's a muscle recruitment issue that's dictated by running technique or running style. And one of the easiest things to do before you run is just tweak your form a little bit, not completely change it, but use another muscle a little more and let that one relax, especially if it's inflamed, so you're not just hammering it the whole time. Another example are the other kind of shin splints that are on the inside of your leg. It's commonly due to your soleus being irritated, and your soleus, well, is the muscle underneath your gastroc soleus. It's right in here, and it attaches on the inside of your leg. It can also be your posterior tib too, but anyway, some muscles there. What those muscles are primarily involved in doing is pushing off. And if you are only using your ankles to run with and pushing off, you can really overload that tissue really big time. And you can, and what should you be using instead of just your ankle? Your hips. So when I'm pushing off, it's an opportunity for me to use this, and this to drive with. And you start looking at runners, and you'll notice some people just have these really huge calves and like no glutes. So it's something to think about, right? And so if you're really hurting in your shins, another thing to think about is to really think about how can I let my foot go, relax a little bit more? How can I drive more with my hips? So efficiency with running is sharing the demand throughout the body. Every muscle does its share, so it's not all located on one muscle. And that can have to do with just style or technique. Another thing are muscle imbalances. So if I were to muscle test every one of you, we used to do running clinics all the time, and we'd run through, probably in the course of several weeks, we'd run through about 100 runners and test every muscle in their body. What we typically see is really super strong quads, strong calves, strong hamstrings. What I would see a lot is weak glutes and repeated hamstring strains for the reason I just told you. When you're running, you want to push off, you want to use all these guys. If your glutes are out to lunch, you have to use your hamstrings more. I'd see this when people come in, they say, you know, when I started getting interested in this when I was first a physical therapist. It was so fun to help people get better. And then 6 months later, they'd come back in and go, oh man, you got to fix my hamstring again, it's bugging me again. I'd be like, I thought I did fix it. I didn't fix it. It's hurting again. It's like, so what's up with that? So that got me thinking, well, so what's under it? Stretching it, massaging it, that just helps the symptoms, which is valuable. But if it comes back, there's something else. So there's one scenario. Another scenario is weak lower abdominal muscles and IT band problems. So when your lower abdominals are weak, your pelvis can tend to fall into a position like this a little bit. You'll see a lot of people running like this. When your abdominals let go, it puts your IT band in a mechanically advantageous position to function, and so it does. Your tensorofasciolata IT band, it gets used like crazy, and people have just repeated IT band problems, irritation, you have to roll it out and you run and it gets tight back and forth. A lot of it can come from lower abdominal weakness. One last one I'll tell you about is your deep hip external rotators. Really important muscles that people don't think about a lot. So if you take your big old glutes off, you've got 5 muscles deep to your glutes that attach to your femur and turn it out. If those muscles are not strong, and other muscles are, it'll allow your leg to fall in like I talked about before, which compromises your knee, your foot, and your hip all the way up and down. So muscle imbalances are another issue that can really compromise your efficiency in running. Okay, so finally, I want to talk about, make sure I'm not missing anything else here that is really good. Oh yeah, muscle firing pillars. Okay, that's good. So shock absorption, that's the last thing I wanted to talk about here with running efficiency. So shock absorption. Okay. So I want you guys all to stand up for a second. I want you to feel something in your bodies. So this is a little drill I do a lot with people and actually is helpful. So in a minute, I want you all to jump up and land as soft as you can. So ready, set, go. Okay, good. That's actually pretty good. Pretty good. That sounded good. So let's go again and really anticipate when your foot is going to contact the ground and think about really rolling through your foot. So go ahead and jump up again and come down really soft. And you'll start noticing that the more you can let your other joints participate in the shock absorbing process, the softer you land. So let's go again. Go ahead, come up and come on down. Good. One more time and really think about catching and really rolling through your foot. Go ahead and come up and come down again. Yeah, good. That is something you can play with and listen to, because I really can't, this buffers a lot. If you get on a hardwood floor, you'll hear yourself more. But go ahead and sit on down. That simple little drill can be super helpful at working on how do you get your body. Shock absorption has to do with timing, and it has to do with foot mechanics, and it has to do with the amount of dexterity you have in your foot. So are you guys interested in the conversation of barefoot running, like, having more minimalistic shoes, yada, yada, yada? Yes? Okay. Because I put a lot of thought into that, and I get this question a lot. And so the big trend that's been going on is to have less and less underneath your foot. And I think the biggest gift that's come from that is it's taken all of our attention back to the importance of having good dexterity in our feet. It is a big deal, and we really do need it. I remember a long time ago there was a video of a woman who was born without arms below her elbows, and she could safety pin diapers on her baby with her feet. So we have that kind of capability in our feet. The anatomy of our feet is really the same as our hands, except our big toe doesn't oppose. But the amount of dexterity that we have in our hands, a lot of it is really capable in our own feet. Except we kind of shove our feet into shoes and sort of walk around like this, and we lose a lot of what's possible. And that dexterity is a lot of what has us be able to shock absorb. So there's tons of value to thinking about and trying to regain our ability to have dexterity within our feet. I can tell you as a physical therapist, someone who looks at foot mechanics, when we use our feet correctly, it changes how we fire all the way up our body. So I do think that they can be really valuable. I think less is more. I think the less stuff we can have up under our feet, the better. There's a caveat to that. Some people really have structural problems in their body that makes it to where they really do need some help to balance out that alignment. I'll come back and talk about that briefly. And then also, if you don't have the endurance, it's not smart to really drop down to a much softer shoe. We've seen tons of injuries with people that don't have the endurance who have dropped down to five-finger shoes or really super soft shoes because they don't have the endurance. So I think being the right person who's got the structural integrity and the endurance, I think it's a great thing, but it's not for everybody. So I would be one of those people that it's not for, and I'll tell you why. When I would run, for many years, I had a tremendous amount of left knee pain. I also had pain in my big toe, in my hip, in my SI joint, and in my back, all on the left side. I was like, this should mean something to somebody, that it's all on the left side of my body. I went to so many different people, and one person would look at my knee, one person would look at my toe, one person would look at my hip, and I got tons of exercises. Finally, I had literally 2 hours worth of exercises. It's like, dadgummit, I'm doing it. I did it for 3 months straight, and I was in tears by the end of it because I was no better anywhere in my body. And so finally, Dr. Davis in town did surgery on my knee. He went in and found nothing. He said, I saw a little bit of plica, some folding in your synovial. I could have cut it, but you'd have bled a lot, so I didn't want to do that to you. I don't know why your knee hurts. So it's like, so I went ahead and I ran, even though my knee hurt, because what are you going to do? It hurts anyway. I backpacked, I rock climbed, hurt getting in and out of a chair, so whatever. Every time I took a class, my mission was to fix myself, right? And it was so frustrating. Here I was 8 years into being a PT, and I could not fix myself. And so every time I took a class, I would tell the professor, I'll pay you to look at my knee. I'd get more exercises until one day I took a class from this guy, Gary Gray, taught biomechanics up in Pennsylvania. And he said, well, let me watch you walk. And he said, you've got tibial varum, which is like bowed legs, I'm like, well, yeah. He said, you need orthotics. I said, well, I got orthotics. I kind of felt unstable in my body. I was one of those whose knee wanted to go in all the time. I could tell it didn't feel right. But everybody just sort of said, well, you got a funny looking leg, and didn't have much advice to go with it. So I went to the best person in town, got a pair of orthotics. She looked at my feet. She said, your feet aren't that bad, but if you want a pair of orthotics, I'll make them for you. So she did. They didn't do much. I didn't know what else to do, so I wore them anyway. He said, they're not corrective enough. You need really strong corrective orthotics. Let me have them. I'll send them in, and I'll send them to you. That was the beginning of the end of all my pain. It was awesome. So when you have tibial varum, your lower leg is curved. And so for me, just show you one of my legs. So I don't know if you can see that.
but my lower leg is bowed. It's not terrible, but it is. So it goes like this. So I have two choices. I could stand on the outside of my leg and all my joints line up, or I can collapse in like this, and then here's my leg here. So I can do yoga and I can strengthen. I can kind of hold myself here. I cannot carry an 80-pound backpack like I used to, and I cannot run long distances and sustain this. I finally start losing it, and then my joints are compromised. I'm somebody who would not do well barefoot running. I definitely benefit from having a shim under my foot to stack myself up, and then I can push myself really hard athletically and not have pain. So not everybody needs orthotics, but if you do, they can make a big deal. It's kind of like wearing glasses. And it's something that I ended up specializing in because I had so many people coming in, spending all this money on orthotics that weren't doing anything. So it's something that I committed a lot of time and energy to, and it's something I specialize in. If you guys are interested in that, make sure you find someone who looks at your whole body and not just your foot. I also spend an hour fitting people in orthotics to make sure they're right after you're made. So make sure that whoever you get them from really spends that time, an hour on the front end, hour on the back end, measuring, making sure they're right, because that part makes all the difference. So let me have you guys stand up just for fun, so you can assess yourselves. And why don't you pair up so you can watch somebody and feel it yourself. And the first thing we're going to do is put your hands on your hips so you can feel where your pelvis is in space and your friend can kind of see it. And then I want you to stand on your right leg and just balance there. Right away, some people will really have to start wobbling hard through their foot because they might have foot mechanic issues. Other people are solid. Now go ahead and do a squat on that side and see where your knee goes. And you can go together or go one at a time, but watch your friend and watch yourself and see where your knee heads. Does it track over your toes like those pictures I showed you, or is your knee going in an opposite direction?
Wait. This plate is straight, yeah.
Okay, then switch out to your other leg. And you might notice that you have better balance on one side than the other. Could be similar. Kind of notice how hard you have to work through your ankle. And then go ahead and squat. I didn't draw your attention to the pelvis, but watch your friend and see if one hand is lower than the other. Do they lose their alignment in their pelvis, or do they stay level? Where does their knee track? Does it track straight ahead over their foot, or does it go off east or west at an angle?
Yeah, just a little.
Check it out.
Like if it shoots her.
Okay, and you can go ahead and sit on down. But that's one thing you can kind of, one quick way to self-assess. If you guys are interested in more of this type of thing, being able to assess yourself, nail me at the end, and I can also show you things to do to help with this that may not apply to everyone. So the last thing I'll close with is I always have people that come in and say, man, I'm getting old, my knee's killing me, I know I'm just old. The last two people who said that to me, 20-year-old and a 30-year-old. They're not old, but the 20-year-old has been playing tennis with her twin sister since they were about 7 and trashing their body, really, really pushing themselves hard. The 30-year-old is a pretty hardcore rock climber. And both of these, they're kind of feeling devastated, like I can't push myself like I used to, I'm just getting old. So why is it that we sometimes feel old and it's not old age? I had a lady last week, I did a running mechanics assessment here, and I said, let me see you stand on one leg. She said, oh, I can't do that, I'm old. I'm like, you're not old. Let me see you squat on one leg, and she really couldn't. And then on the other leg, she could squat on it. And I'm like, well, this leg belongs to you, and this leg belongs to you. They've lived the same amount of time. It's not age, it's mechanics. But we really feel like it is. So what happens in our body? What happened to that 20-year-old? What happened to that 30-year-old? That they really feel old. Our bodies were designed to adapt much quicker than they were designed to heal. If you have an injury, you'll figure out how to adapt around it way before you heal. A good example of that is I had a patient who had a lot of heel pain. And he's a long-distance runner. He was also the manager of a restaurant. He said, all right, it's bad enough to not be able to run. Now I cannot work because my heel hurts so bad. He's like, all right, well, let me assess you. While I was evaluating him, I had him kind of come up on his tippy toes, and he couldn't do it on that side. And I'm like, so what's up with that? He said, oh, you know what? A year ago, I had Achilles tendonitis. I said, well, what did you do? He said, well, I kind of rested a couple weeks, and I could go ahead and run, so I did, like any of us would do, right? Well, what he learned how to do is not push off and use his Achilles tendon. So when he would run, he just sort of picked up his foot and he'd kind of come down hard. And so when he walked, it's kind of hard to tell you, showing you boots, but when he would walk, he didn't push off with his foot. He just kind of kept his toes lifted. He'd learned how to adapt, and he came down on his heel really hard. Can you see how that would happen? Instead of pushing off and using his body with a lot of dexterity and shock absorption. And so we'd go back, fix the Achilles tendonitis, so that we could help him with his heel pain. So it's a classic example of how we adapt really quickly. So I want to turn the floor over to Kate, and she is a massage therapist who's going to give you guys some... Okay, yeah. So let's hand it over to Jody. But Ben and I will be here to field questions if you have any. We'll definitely, and we'll come back when Kate's done. If you guys have specific questions about specific injuries, we'll do that as a group. And then if some of you want specific answers to specific questions, we'll hang out late tonight and answer those as well. Okay? Thank you, Rebecca. Okay.